Good morning, everyone, and Assalamu alaikum wa rahmatullahi wa barakatuh. Peace be upon you. I am your host, Sammy Hegab, and today's reaction video is a very important, crucial topic regarding weight loss, and in specifically, it's about reversing type 2 diabetes. I'm sure we know someone in our lives, whether it's a family member or a friend, that is suffering from diabetes, and it's predominantly, and the root cause of that and other diseases is obesity. So this video was created by Jason Fung. It was Dr. Jason who was speaking at a university event, a conference, I believe in Canada. This was about a year or a year and a half ago, which he gave this presentation on how to reverse type 2 diabetes, which we all know it's actually reversible. It's not a progressive disease like some may be made to believe. I am a big fan of Dr. Jason Fung, and I actually did benefit from a lot of his material. As a matter of fact, I've also got his book, The Obesity Code. It's a very interesting read where he challenges the medical industry and proves them wrong in so many points, as well as he gives his great advice about fasting and cutting out sugar and carbs and so on. So he gives a lot of useful information in his book. Now, in this video, I hope you will enjoy it. It's been a while since I watched it. I probably watched it about, I think, a year ago when it first came out. But I am going to watch it again. And then I'm going to try to refresh my memory on some of the points that were made during the talk. And I will try to do more reaction videos so people can actually benefit from his knowledge and wisdom in this subject. Now, he's not the only doctor that talks about the benefits of fasting and the ways to reverse type 2 diabetes and how to reduce your weight and burn your stored fat around your organs and your body. So he's not the only doctor. There's Dr. Eric Berg as well, who's very popular in this topic. And he's being shadow banned now by YouTube because a lot of his content contradicts what what they're trying, the mainstream, whoever, I don't want to mention their names, are trying to pump out and deviate their attention. So you could be more dependent on drugs and pills and medication rather than going all the natural way and seeing results. And for those that are actually watching my channel for the very first time, I can tell you that about almost the start of the year, I was almost 130 kilograms in body weight. And through so many different attempts of losing weight, I discovered that the best method was fasting. And I started doing that. I started walking regularly as much as I can. As my weight started to go down progressively, I then went on a prolonged fast in August this year, about 60 or so days ago. And my weight started to go down. I am now around about the 81 kilogram mark. So from almost 130 to 81, you're talking about almost 49 kilograms weight lost in just a few months. Of course, in the first few months it was a struggle before most of the weight started to drop in the past couple of months. So just to give you a perspective in the picture, it wasn't like gradually it was going down. It was going down, and then I had to experiment and discover what worked and what didn't work. I had to discover if there was any bad habits. For example, I used to drink quite a lot of energy drinks. I drink quite a lot of coffee as well, especially if I'm working, just to stay awake. I was low in energy, so I was depending very heavily on caffeine. I still drink coffee, but I've tried to reduce that, and I also still drink now and again these zero sugar energy drinks. However, it's a bad vice and something that I need to tackle as well, because also sweeteners and all that stuff are actually still harmful, as harmful as taking glucose. So yeah, I've been working on that, but I've been now doing a prolonged fast, which is basically not eating any soluble food, and I am going to start to progressively go out of that prolonged fast. So I've done that for about 60 days or almost now 70 days, but I'm starting to now going to start introduce eating soluble food, but gradually. And I will be very picky on what I consume because I want high quality food, proteins, high quality healthy fats as well. And so, because you need all that for your body to grow and develop, you need fats. Contrary to common belief that you need to eat a low fat diet is completely false. You need a high fat diet and you need a high protein diet, especially if you're going to the gym and trying to do bodybuilding. So yeah, that's a piece of information for myself, and I don't want to delay you from the main content of the video from Jason Fung, inshallah. So what I'll do now is I'll play the video and I'll let you enjoy it, and then in between I might make a few comments, or I'll wait until the end of the video and I'll make my final conclusion, and meanwhile I'll try to take some notes as well on the side so I can remember some of the key points that I need to bring to your attention, inshallah. So although this topic is talking about reversing type 2 diabetes, if you're interested in reducing your weight or you know, for your weight management and losing lots of weight and you've been struggling with obesity in some way, this will be beneficial for you because he does touch on all these topics as well. Okay, so type 2 diabetes, high blood pressure, and all this other disease, inflammation in your body, and all these things are actually symptoms of obesity. So it's not that they're a different disease. The root cause of all that is obesity, overweight. If you're overweight, you will face one or two or possibly all these conditions, okay, and more. So this is something to pay attention to and try to address it. And don't lose hope, because you can reverse a lot of these conditions, but the sooner the start, the better for you, inshallah. Okay, so let's get started now. I'm just gonna play the video and
And this is the period where they talk about insulin resistance. What you get is this compensatory hyperinsulinemia, which keeps the blood glucose down, and that's why you don't see this sudden spike. And then at some certain point, you get this second phase where things just shoot up. And that's that loss of compensatory hyperinsulinemia, and they call it pancreatic burnout. What they say is that your beta cell has basically been working so hard, it's burned out, so you can't produce the insulin. Even though your insulin levels are much higher than normal, they're not high enough to keep the lid on the glucose, and therefore the blood glucose shoots up. You blow past whatever diagnostic criteria you have for type 2 diabetes, and this is what happens. So what they're postulating is that, and this is the traditional thinking, is that this is why it's an irreversible disease, because you have this pancreatic burnout, and you can't reverse this part. And they're two entirely different disease processes. One is high insulin resistance, the other is a sort of scarring of the pancreatic islet cells. So they have nothing to do with each other, and yet they only occur sort of one with the other and never with any other disease, which is a little bit strange. But that's why they say it's irreversible. And of course, this is what you see. So you see, if you look at fasting insulin levels, you see this hyperinsulinemia. So as you go from the spectrum of normal lean to obese, to obese with type 2 diabetes, you see that the insulin levels are going up and up and up, and that's that insulin resistance and / hyperinsulinemia. And this is the glucose tolerance test compared to the insulin. So here's the glucose, here's the insulin, and this is what we know as you go from the spectrum of normal, lean, to obese and type 2 diabetics. What you see is that at first, this is your insulin levels. It's in the solid circle, so it's going up, and then at some certain point, even though your glucose is going up, the insulin actually starts to drop. So yes, your insulin is higher than baseline, but it's not as high as it was before, and that's that loss of compensation, and that's pancreatic burnout. And the big change is that for years we said that type 2 diabetes is chronic and progressive because of this progressive burning out of the pancreatic islets. But in 2021, the big change was that this was actually a reversible disease and not progressive. So this is the American Diabetes Association, and what they used to say was exactly this. This was on their, it was under Diabetes Basics, that type 2 diabetes, for most people, is a progressive disease. They got rid of that. In 2018, they removed it. It's gone. You can't see that anymore. And instead, what they have is this. In 2021, they came out with the diabetes remission criteria, which of course implies that remission is possible because you don't define it if it's impossible. So it's a huge change because if this is a disease that can be put into reverse, that's what we should be doing. And what I'm going to talk about is the pathophysiology behind why we think this is so. So if you think about reversal of type 2 diabetes, people think that it's impossible, but we've actually shown it for many, many years. So for example, you can take bariatric surgery. It reverses type 2 diabetes very clearly. This is data from 1992, so this is from 30 years ago. If you do bariatric surgery on people, the blood glucose falls almost immediately, and the results are, for the most part, very long-lived, so going out 10 years or so. So this is the data from the New England Journal of Medicine. This was, again, Roux-en-Y gastric bypass versus intensive medical therapy, which, of course, at the time was mostly insulin and sulfonylureas. You can see that over time, if you just give medical treatment, they stay on the same number of medications, and they don't lose weight. But if you do surgery for these people to make them lose weight, then the blood glucose falls immediately, so they get off of a lot of medications. They come down right away. So remember, this is long before they've lost weight. So, at a month or 2 months, they may have only lost 20, 30 pounds if they weighed 500 pounds. That's not a lot from a percentage standpoint. But the blood glucose has gone down. They're getting off all their meds. Even out to a year, a lot of them are still continuing to get off all their meds. And yes, this is a drastic situation, but the point is that this is a disease that is reversible. That's very clear in these studies. It's that we didn't focus on the right things. We focused on giving more meds, but giving more meds is never going to work. If they lose weight, their type 2 diabetes goes in reverse, which we always knew, of course. And you don't have to cut out pieces of the stomach. You can do gastric banding, and you'll see exactly the same results. The blood glucose falls immediately, like even within a week. We see that fasting is also something that has helped people reverse type 2 diabetes. And this is, again, not new. So this was written by Dr. Elliot Joslin in 1916, so this is more than 100 years ago. And he wrote in the CMAJ that temporary periods of undernutrition are helpful in the treatment of type 2 diabetes will probably be acknowledged by all after these 2 years of experience with fasting. So he thought it was so obvious that you wouldn't even need to do a study. And this is probably the most famous diabetologist in history who is writing this 100 years ago. Because for type 2 diabetes, if you lose weight, yes, your diabetes will go away. And he thought it was obvious. Then, of course, what happened was that they discovered insulin. Everybody forgot about dietary treatments, and we went ahead and gave a lot of insulin to people. And if this was in the BMJ, as an article, a case report I wrote, and it was under The Myth Exploded that you could actually reverse type 2 diabetes. And they did an article in Reader's Digest, and these are some of the people who did reverse their type 2 diabetes just by using intermittent fasting. You see, of course, that a lot of them, they lose a lot of weight. When you lose weight, your type 2 diabetes goes in reverse. And very low carbohydrate diets can also put people into remission. This is from the American Diabetes Association. So again, this was only published in 2020, and this is a consensus report from the ADA, and when they're talking about eating patterns, what they say is that reducing overall carbohydrate intake for individuals with diabetes has demonstrated the most evidence for improving glycemia. That is, it's not some kind of fad diet that has no scientific bearing. It is, in fact, the diet with the most evidence for reversal of type 2 diabetes. And this is a study from Dr. David Unwin in the UK, and he has been using low carbohydrate diets in his practice. He just gives people a handout and he tells them, cut your carbs down. So this is his experience over 6 years. And what's interesting is that over a period of 23 months, he had a type 2 diabetes remission rate, drug-free remission, of 46%. So almost half of his patients that chose to do this not only came off all their drugs, but had an A1C so low that they were considered no longer diabetic. Half of his patients. If you do the same thing with pre-diabetics, their A1Cs go down to a level that they're considered normal, not pre-diabetic, in 93% of cases. So this is all real-world experience and backed up by, the scientific data. It is a disease that can be put into remission in half of our patients, and that is a huge number of patients. It's going to have a huge impact on your practices. And there was no threshold above which it was not successful. So even if you had A1Cs up in the 15% range, they still came down when you restricted carbohydrates. So compare that. So these are strategies that reverse type 2 diabetes. We know it, we've seen it, everybody's done it. In fact, everybody knew it already. So if you had a patient who said, well, hey, I had, lost 50 pounds, my diabetes went away, I got off metformin. You'd say, great job. You wouldn't say, hey, you're such a liar, right? It's chronic and irreversible. What are you talking about? No, you knew it. Everybody knew it. Every patient knew it. Every doctor knew it, that this was a disease that could go into reverse. Yet, for years, we focused on things that just led to progression. That is giving more insulin, giving more sulfonylureas, giving a low-fat diet. None of that actually made any difference. Things just continued to get worse. So what was the difference? And there's two key concepts when you understand what insulin resistance is, what type 2 diabetes is. That is the underfill versus the overflow, and looking at the blood glucose versus the whole body glucose. These are concepts that I think about a lot as a nephrologist. So what is insulin resistance? What is this disease process that we're all worried about? Well, this is how we think about it. This is the classic teaching, which is a lock and key paradigm, right? So this is normal insulin metabolism. You have a cell here. You have glucose, you have insulin. Insulin sort of fits like a lock and a key. It brings it opens up your gate, and glucose goes into the cell to be used for energy. So when you have insulin resistance, people say, something's going on here. There's a problem. Now you can sequence the cell here. You can look at the insulin. Insulin molecule is normal. Insulin receptor is normal. So maybe it's like a piece of gum or something that's in the lock, and it's sort of screwing up the key. So when that doesn't happen, what happens is that you don't get the glucose. It piles up outside the cell, which is what you see. And inside the cell, presumably, you have internal starvation. That is an underfilled cell. You have no energy here. We don't know what causes it. Something causes it, but it causes this internal, insulin resistance, which leads to compensatory hyperinsulinemia, which then drives the glucose in. Now, the problem with that is that in this situation of internal starvation, this is exactly, of course, the situation you see in type 1 diabetes, but in that case, of course, you don't have insulin. But you get the same low intracellular glucose, and this is what untreated type 1 diabetes looks like. So you see this person is super, super skinny, cannot gain any weight. No matter how much food you give this poor girl, she will not gain any weight because insulin is necessary for that energy to go in, for the glucose to go in, for you to store energy. You need insulin, so she cannot store energy. She gets thinner and thinner until she dies. And then, of course, you give her insulin and she goes back to normal. So that's internal starvation. But this is type 2 diabetes. Phenotypically, it looks nothing like that internal starvation. It's a real stretch with this person with all their abdominal obesity, their big fatty liver, to say that this is a state of internal starvation. I can't see it, and it looks nothing like real internal starvation. So that's a bit of a problem. So when you're thinking about the resistance, what you're talking about is that you have all this glucose outside the cell, and it cannot go in. But there's two possibilities as to why it cannot go in. You could have a malfunctioning insulin receptor, that gum in the lock and key, or the other possibility is an overflow problem. That is, your cell just has too much glucose, and that's why it can't go in. So you have, the primary problem is not just the glucose in the blood, it's the glucose in the whole body. So if you have a situation where you have high insulin levels for a long time, you've been spending decades just shoving glucose into the cell. It keeps going in and in and in. And now there's just too much. And that's why it's piling outside. You can't fill it in. It's an overflow problem. That's a possibility. So it has real implications because the way you treat it is going to be completely opposite. In the internal starvation mode, you're going to give more insulin because that's the right treatment. Same as type 1 diabetes. That's the right treatment. In type 2 diabetes, if it's an overflow problem and you have too much insulin, giving more insulin doesn't solve the problem. You're just going to keep shoving this glucose into this overfilled cell. And the minute you stop giving the insulin, it's just going to come back out. And you're not going to make the problem better. You're going to make the problem worse because you're filling this overfilled cell. So if you think about it, it's sort of like a suitcase, right? We're putting clothes in. It's going in, no problem, no problem, no problem. All of a sudden, you can't put those clothes in anymore. You can't put in those last 2 t-shirts. It could be a problem with the locking mechanism, or it could be that your suitcase is full, right? Both are possibilities. Think about it like this. If you have a train, which is like your cell, and you have glucose, which is like the people standing on this platform. Normally, insulin opens the door, people go in. If all of a sudden you see people piled up back out here, 2 possibilities. 1 is the door didn't open. 2 is that there's just too much people inside. So giving more insulin and shoving people into that car doesn't make it better. It makes it better temporarily because there's less people here, but it makes the overall problem worse because you're overfilling an overfilled train already. So how does that work from a biochemical standpoint? Well, it's very simple, really. And again, if you think about what happens to glucose, it undergoes a sort of very stereotypic process. So glucose undergoes this process called glycolysis, which turns into pyruvate. Amino acids come in here and fatty acids come in here. And essentially you go from pyruvate through pyruvate oxidation to acetyl-CoA. And acetyl-CoA is kind of the sort of baseline. So fats can do it, amino acids can do it, glucose can do it. So any of those can do it. And from there, you go through the citric acid cycle, and you generate ATP, which is cellular energy. Now, you can't just keep on doing this forever, because if you have too much ATP, it's toxic. You have too much energy, right? It's just like if you have too much heat, you just burn down. Your cell doesn't want to do that, so you don't want too much ATP sitting inside your cell. So if you're shoving in all this glucose and you're generating ATP, it's going to naturally put a stop on all of these processes, the citric acid cycle, the pyruvate oxidation, and the glycolysis, which is going to lead the glucose levels inside the cell to go up because you don't want to move your glucose into ATP. So when you're backing up your glucose, your internal cell glucose is going up, what happens when you open up that gate? So insulin attaches to its receptor, opens up the GLUT4, the gate is open, but it can't go in because this depends on facilitated diffusion. You need a concentration gradient between the extracellular glucose and the intracellular glucose in order for this to go in. If you've just backed up all your glucose, that glucose just backs up out the door. And that's exactly what you're seeing with insulin resistance. So let's follow this through logically. So what happens to that excess glucose? So now you've got all this glucose sitting inside your liver cell. Your liver doesn't want all this glucose. It doesn't want ATP. It can't generate that ATP. So you activate this process called de novo lipogenesis, which is here. And essentially you're taking glucose, going through this process of acetyl-CoA, citric acid cycle, and then you're eventually creating triglycerides, which is fat. That's what de novo lipogenesis means. It's de novo, which is from new, lipo, which is fat, genesis, the creation. It's the creation of new fat from your glucose because you have too much glucose. Your body is busy turning that glucose into fat. And that's the reason almost all of the type 2 diabetics have a big fatty liver. There is no internal starvation going on. We know in type 2 diabetes that de novo lipogenesis is going crazy. So you're generating a lot of fat from glucose. If you were to say that this is all a problem with internal starvation, a malfunctioning insulin receptor, if you don't have any glucose inside your cell, how are you going to make triglycerides from the glucose that does not exist? Right? It's like building a brick wall with no bricks. You can't do it no matter how many carpenters you have. So if you have no glucose inside the cell, you cannot generate fat to give you fatty liver, which we know clinically that most of these patients are going to have. So again, let's follow this through. So you're generating all this new fat in the liver because you had too much glucose, too much insulin. The liver don't want to hold on to that fat. It's not supposed to be stored in the fat. So it tries to get rid of it. This is the process of cholesterol transport. So you take the fatty acids, package it with some cholesterol and some lipoproteins, and you send it out as very low density lipoprotein. Goes out into the blood, right? So you've got all this excess fat. Your liver is trying to dump it out. It's trying to get rid of it. So it goes into the blood. So you see very high triglycerides. The triglycerides bring those fatty acids in the blood. You activate lipoprotein lipase, and it goes into fat cells. That's where you get the abdominal obesity that you see in type 2 diabetes, which then goes to intermediate density lipoprotein and lowers the HDL. So what you see is high triglycerides, low HDL, which goes to LDL, and that may go up as well. But what you're seeing now is, okay, here we have a process of hyperinsulinemia, too much insulin, too much glucose, overflow situation, not underfill. You're going to get abdominal obesity, you're going to get this insulin resistance, you're going to get high triglycerides, low HDL, and you're going to get high blood pressure because insulin is an antidiuretic hormone. So it causes your kidney to retain salt and water, which is going to increase your blood pressure. Well, what are those 5 things called? This is literally the definition of metabolic syndrome. It all goes together. Why do these cluster of things all go together? Is because they have the same underlying cause. They're all hyperinsulinemia. Your body is trying to get rid of that excess fat by throwing it into the abdomen. It's trying to block more glucose going in, so you get glucose out the cells. You got the triglycerides, the HDL, and the hypertension. It's all part and parcel of the same process. So again, if we compare the two ways of thinking, and again, this is the underfill. So you say that the main problem is internal starvation, some kind of malfunction here. What causes malfunction here? Well, nobody knows. After 50 years, nobody has any clue what this is. It's some mystery villain that has been eluding scientists for decades. Even as it causes a worldwide epidemic, we just don't know what's causing this malfunction. Some people say it's, fat, and some people say it's inflammation, and some people say it's this and that. Well, that's not very satisfactory. So this entire hypothesis, which is some mystery, causes insulin resistance, causes hyperinsulinemia, and this intracellular starvation is going to make some predictions in terms of clinical medicine. This will predict what we're going to see in clinic. It's going to say, no, you're not going to have fatty liver. It's going to say, no, you're going to be skinny, not fat. It's going to say, hey, you lose weight, it's not going to make any difference because you have internal starvation. It's going to say insulin makes things better. That's the right treatment. And the pushing the glucose from the blood inside the body will make things better. And of course, every single one of these predictions is completely incorrect. We know this since 2008 with the Accord study. That is, when you give people lots of insulin and sulfonylureas to make that blood glucose down, you can bring it down, but you can't make them better. In fact, you might make things worse. That's why the A1C targets have gradually gone from 6% to like 8%. And think about this for a second. If your problem is that you've got too much blood glucose and you give them lots of insulin and shovel all that blood glucose into the liver, like you never got rid of the glucose, what's going to happen? Well, your liver is going to turn it into fat, which means you're going to get weight gain. If you get weight gain, your type 2 diabetes gets worse. So you're making the blood glucose better, but you're making the type 2 diabetes worse. No wonder you didn't have an effect. And it wasn't shown in just this study. Of course, every other study does the same thing. This was the ADVANCE study, which showed that even after 10 years, you couldn't show any difference to lowering blood glucose by giving more medications. And compare that to this other way of thinking, which is this is an overflow problem, right? The problem is too much insulin, too much glucose. This resulted from dietary changes. We're eating more refined carbohydrates. We're eating more often.
Seems like the picture is actually frozen, so not quite sure why this keeps happening with Real Player. It just freezes after a few minutes. So we covered about 22 minutes of Jason Fung's video presentation. It was really good. It's fantastic. I might actually need to restart that video and come back to that same point again. So yeah, just bear with me a second here. Let me try to restart the video. Okay, let's start from here and see how it goes, inshallah.
Wide epidemic. We just don't know what's causing this malfunction. Some people say it's, fat, and some people say it's inflammation, and some people say it's this and that. Well, that's not very satisfactory. So this entire hypothesis, which is some mystery, causes insulin resistance, causes hyperinsulinemia, and goes into the liver. Liver. 6% to like 8%. And think about this for a second. If your problem is that you've got too much blood glucose and you give them lots of insulin and shovel all that blood glucose into the liver, like you never got rid of the glucose, what's going to happen? Well, your liver is going to turn it into fat, which means you're going to get weight gain. If you get weight gain, your type 2 diabetes gets worse. So you're making the blood glucose better, but you're making the type 2 diabetes worse. No wonder you didn't have an effect. And it wasn't shown in just this study. Of course, every other study does the same thing. This was the ADVANCE study, which showed that even after 10 years, you couldn't show any difference to lowering blood glucose by giving more medications. And compare that to this other way of thinking, which is this is an overflow problem, right? The problem is too much insulin, too much glucose. This resulted from dietary changes. We're eating more refined carbohydrates. We're eating more often. We're eating more, which is going to lead to hyperinsulinemia because insulin is a nutrient sensor. That hyperinsulinemia means you're shoveling all this glucose into the cell. That's going to overflow. Your glucose is going to go back. You're going to get this so-called insulin resistance, which is going to cause compensatory hyperinsulinemia, which is ultimately destructive because, of course, shoveling more glucose in is not going to do any good. So this is also going to make some predictions in terms of clinical medicine, which is that you will have fatty liver. You will have obesity. If you lose weight, all of this, if you get rid of that, the overfilled adipocyte, your type 2 diabetes will go away. And yes, it does. It's going to predict that insulin makes things worse, which it does, and it's going to say that pushing glucose from the blood into the body does you overall no good, which is what the insulin did. And of course, every single one of these predictions, from a clinical standpoint, which is the most important because that's what our patients are seeing, is correct. It's not a new concept. This was from the 2011 Banting Lecture, which is the sort of scientific achievement award for the American Diabetes Association. This is the new thinking from 2011. The problem is not that you have a malfunctioning insulin receptor. The problem is that you have too much insulin. That is the underlying problem, too much insulin, which is then linked back to dietary changes, we can track those dietary changes. We know there's been dietary changes since the 1970s. So it's not some mystery as to what's happening. We can track it back and we can see it. And the treatment paradigm, of course, is completely different. Instead of giving more insulin, you want to lower the insulin because you have too much insulin already. And you got to treat the whole body glucose, not just the blood glucose. Moving the glucose from the blood into the liver does you no good because it's still there. It's sort of like taking garbage and just throwing it under the sink. It doesn't do any good. You can't see it anymore, but it still stinks. And that's the problem. When you take this glucose and just put it into your body and turn it into fat, you never got rid of the glucose, so it's still there causing as much damage as if you didn't. So how are you going to lower the glucose? Well, we have drugs that will do that now. And this is, for example, canagliflozin. So that's an SGLT2.